Hi everyone, I'm Danielle and I'm one of the music therapists with Harmonic Changes out in LA. And welcome to this month's Open Studio. Today I'm going to be talking to you about music therapy and mental health communities. So let me just pull up my little PowerPoint real quick. All right, so here we go. So a little bit about me. Like I said, I'm from LA, grew up here. I got my bachelor's in music therapy from the University of Miami, and I also studied songwriting there. And some of my practicums in Miami included the VA, working with individuals with substance use, as well as post-traumatic stress disorder. And I also worked at a correctional facility. I did my clinical internship at Stony Brook Hospital on Long Island, where I mostly did inpatient psych, both with children and adults. And now I work with adults with substance use disorders, veterans with post-traumatic stress disorder, substance use disorders, and adults with bipolar, depression, schizophrenia. And I really love doing this work. I grew up playing music and really came to appreciate songwriting while I was in high school and found it to be personally very therapeutic. And I'm so fortunate that I found music therapy as a way to pass that skill and that passion on to other people as a means for helping. So that's a little bit about me. So before we get in any deeper, I thought I would just share some important mental health vocabulary. So the first one is sober. So this is one approach to substance use recovery. This means you're living completely without the use of substances. You might also hear someone say that they're clean. Harm reduction. This is another approach to recovery that involves lessening the usage of drugs and alcohol, but not removing them entirely. Detox, again, has to do with substance use disorders. So this is the first step in one's recovery process from that, where their main focus is the psychological and medical symptoms. Next, we have IOP, which is also known as intensive outpatient program. This is a lower level of care, typical 3 to 4 hours a day. Before that, sometimes people will go to residential care. This is a 24-hour program that's more focused on the psychological aspects of the illness, as well as medication management. Next, we have SI, which is shorthand for suicidal ideation, SH, which is shorthand for self-harm, HI, which is shorthand for homicidal ideation. Just a few others. So ETOH is shorthand for alcohol, THC, shorthand for marijuana, delusions and hallucinations. These are both symptoms of schizophrenia or psychotic disorders. So delusions are fixed, false beliefs that conflict with reality. So sometimes I'll meet clients that believe they're the president or a famous musician. Hallucinations are perceived visions, sounds, or smells that seem real but are not. So sometimes people may think that there's a ghost in the room or their parent in the room and they're not there. Mania, a symptom of bipolar depression. This is a period of abnormally elevated or irritable mood, intense energy, racing thoughts, and other extreme behaviors. Some examples of that are excessive spending or binge eating. So some common diagnoses that you'll find in working in some places are like inpatient psych, which you'll get like a variety, and then there's also certain treatment centers that will treat only a specific group of illnesses. But overall, these are kind of the most common mental health diagnoses that I've worked with as a music therapist. So, major depressive disorder, post traumatic stress disorder, generalized anxiety disorder, bipolar disorder, schizophrenia, eating disorders, substance use disorders, and bipolar disorder. Some common settings that I work in: inpatient psych, as I mentioned, intensive outpatient, partial hospitalization programs, or residential programs. Outpatient programs, which is they're living at home, they're just coming for group once a week, and that's that. Or community centers too. So, how do music therapists help? So, this is a list of the goals that I found I most commonly work with clients. So, this will really, of course, the goal will be based on the individual, or if I'm working in a group, kind of major themes of the particular diagnoses. So, some goals that I might address include decreasing pain and increasing relaxation in initial stages of detox, increasing emotion identification and expression, increasing insight and self awareness, increasing coping skills, increasing goal setting, increasing healthy social connections, getting in touch with your past sober self or yourself before you were really struggling with mental illness. For some, this won't be an appropriate goal though. Music association work, increasing mindfulness, and reality orientation. So some common interventions that I use. Song story questionnaire. I'll be showing you an example of that in a minute. Songwriting, group drumming, group instrument playing, music and art activities. So sometimes I'll ask clients to create album artwork that represents where they're in their recovery right now, or create like an album track list to describe your life. We'll also do mindful drawing and listening to music. So kind of just listening to the music, just draw wherever the music takes you. Song sharing, music and mindfulness, guided meditation, music and movement, lyric analysis, and sometimes music video analysis. I just want to check that this is recording. Yes, okay. So the examples. So I wanted to show you two examples of interventions that I do with clients. So the first is a lyric analysis that I'll often do when I'm working in substance use. I really like using Macklemore. For those of you who don't know him, he is a rapper who struggled with addiction and I think depression and anxiety as well, and has a lot of great songs that talk about his experiences, and also like a variety of kind of bigger topics as well on the subject, which is what this song is about. So this is his song, Kevin, and I like to bring this one in for a couple reasons. So the song talks about his experience as someone struggling with addiction and seeing other people struggle with addiction, and also kind of what he's noticing in general in America, kind of about the opioid crisis, the drug crisis, and kind of the over prescribing that doctors can often do, which is often a trigger or a means of people getting drugs. So I found that a lot of people have struggled with this particular thing of, either getting prescribed and falling into an addiction, or kind of going to a doctor and convincing themselves that they need particular medication to feed their addiction. And so I think it pertains to the personal, but also kind of this more national crisis that we have going on, which I think a lot of people in substance use feel very strongly about. And I think really we've had some really fruitful discussion when I've brought this song in. So usually we'll listen to it and talk about what comes up for them. We might do a little lyric rewrite as well. Yeah, so that's that one. And then the song story questionnaire. So this is something I learned at my internship, actually. And basically what this is I like to do this when I'm first meeting clients as well, because it's a way to get to know each other. And so basically I've listed a bunch of different categories, and I ask clients to write down songs that they associate with each category. And if they can't think of songs, because it's sometimes hard to think of songs off the top of your head, I'll just say you can write down a genre or a lyric they can remember, or even just a memory that they would like me to know about. So some of the categories are your childhood, a happy time, a sad time, a carefree time, your rock bottom, where you are currently in your recovery, what you want your life to look like or feel like 5 years from now, and any other songs that are important to you. Again, depending on the setting, I might tweak some of these a little bit. But yeah, I think this is a great one to get to know the client, for group members to get to know the other members in the group. And also, I feel like it's often brought up discussion points that we might not otherwise get to, in a group. Yeah, so I really like where the discussion kind of takes us. So that's how that goes. Just get back to presentation. All right, so, and then I just wanted to, I thought I'd talk a little bit about some clinical kind of issues that I've come into contact with, or that have occupied my mind. So one of them is kind of the battle that I kind of go through in my mind often, of using music that may be potentially activating or not. So on one hand, using music like the Macklemore song, clearly they're talking very specifically about drugs, and I think even dosages. And so that can be really triggering or activating for people. And so for some, it can be, a real sore point, and they might not want to talk about that at all. Obviously, because they're trying to, not think about using or drinking. But also, if you don't bring those kinds of songs in, are we just kind of avoiding these realities for the clients? Because they are going to face all kinds of triggers or activations out in the world, and it could also be a good opportunity, to practice facing those. And I guess kind of what I've come to is that it really depends on kind of the group or the client. And usually before I will pass out lyrics to a song like Kevin, I'll kind of just take like a little, I'll just ask the group kind of like, does everyone feel safe? Kind of listening or talking about a song that mentions specific drugs or dosages. And if someone doesn't, then I'll always have a backup and kind of move forward from that. The second issue, I don't really like calling it issues, but I couldn't think of a better word, but is frequent, they call it frequent flyers. So basically what that means is people who are in treatment often. And that kind of goes along with high rates of relapse. So, for certain mental illnesses, the rates of relapse right now are really high. And I'll see clients sometimes 4 or 5 times a year. And I'll struggle because, I have all those interventions that I can do, but, often they'll be treatment fatigued. And so I will struggle sometimes to be like, okay, what is something else that I can offer them that maybe they haven't gotten at another treatment center, or they haven't spoken about 10 million times already. So yeah, that is something that I grapple with, and oftentimes I'll kind of just ask them like, what can I do to make this time, valuable or useful, most useful to you? And then the last one is group cohesion. So I think this is kind of an issue that comes up in most settings, but I think can be especially interesting working in mental health, just because you do get such a variety of ages, genders, sexual orientations, upbringings, levels of education, and motivation for recovery. That last one, motivation for recovery, is probably one of the most difficult elements of a group to kind of bring together, because sometimes you'll have someone who's really motivated for recovery, and then someone else who has no motivation. And so how can I help both of these people while not abandoning one or the other? And one way that, I try to, kind of have to obviously read each kind of situation on its own, but sometimes I'll utilize kind of the individual that maybe is more motivated, and kind of like building up the client who may not be as motivated as the other one, to kind of share experiences, share something that they've learned, and then also, builds a connection between the two of them. So there's both a lot of difficult and really wonderful elements of working in mental health. So, like I mentioned, relapse is unfortunately just a factor of working in these settings, and it can be really difficult to see. You'll see someone do a lot of good work, they'll discharge, and then you'll see them a couple weeks later. And you build a relationship with them and you just want them to do well. And it's just hard to see, life and the illness just be so tough on them. The sessions, of course, can get pretty dark in content. And again, it's kind of this balance of, okay, we want clients to kind of explore these themes, but also, is this particularly helpful? And of course, it's heavy as well. A lot of the themes that we talk about are, not easy. Sometimes I will have significant countertransference, just as someone who has a history with mental illness. And also, like I said, I would say I'd hope I'm a pretty empathic person. And so working in these settings and seeing people struggle is hard, but I try to use that as, motivation as well to keep going and keep helping. And yeah, of course, talking to friends and talking to other music therapists help. And then lastly, I won't go too deep into this, but the mental health system in America just being broken, and a lot of people having a lot of struggles with access and paying for treatment. And I'm a part of that. And on one hand, I love that I'm a part of that. Not the broken system, of course, but working in mental health, but also that, I'm kind of just like part of this wheel that, is a big issue in this country. So that can sometimes, be a little existential for me. But then there's also, the wonderful and the beautiful parts, seeing clients be really vulnerable, seeing clients heal, the progress sometimes that I will see clients make from, their admission to their discharge are leaps and bounds. And that's really cool to see. Paying it forward. Like I said, I do have history with mental illness, and so it's really important to me that I work in this field so that I can help other people as, I've been helped too. And that makes the work all that more gratifying for me. Next, I feel such an immense honor and privilege that I get to be a part of an individual's potentially life-changing process, and I don't take that lightly at all. And I love that this work allows me to show up as myself and a professional, not just a professional. I guess that's a little bit maybe self-explanatory, but just that I feel like being a music therapist, there's a lot of opportunities to show a lot of your own personality. And of course, there's the treatment plans and the goals and the, interventions. But there's also, forming relationships and being genuine with people. And I love that that's part of my work. So just to finish, I just thought I would share some helpful resources that I've gathered over the years. So the first one's just a way, kind of like an online directory for mental health treatment. They also have other resources and news. Suicide Prevention Lifeline.org. This is info about suicide, preventing suicide, talking about suicide. Then we have yourlifeyourvoice.org, which is a website, talks about mental health for teens. And the last one is an article that I found that's the history and current status of mental health attitudes and care in America. If you're interested in that kind of thing, I thought that this was a really great article. So thank you so much for listening. And if you have any questions, here's my contact info. Feel free to email me at danielle.l, that is an L, not an I, at harmonicchanges.com. And let me just stop sharing. And yeah, thank you so much for being a part of this today, and hope you learned something. All right, have a good rest of your day. Bye.